Hey, I'm Kiki, and in this video, I will reveal the 3 secrets to successfully setting an IV. That being said, I am not a medical professional, and I do not have any sort of professional training in the medical field, but I have had a chronic illness for 10 years, and I've been to so many doctors, and I've gotten my veins poked countless times, and these are the things that I've noticed that have helped me successfully set an IV so that I don't get any vein collapsing or bruising, and the pain is very minimal. So in my last video, I explained how IV therapy really helped me heal from Lyme disease and POTS, so be sure to check that video out. And in that video, I explained how I got IV treatment twice a week. And you are probably thinking, there is no way I can do that with my weak veins. And I totally get how you feel, because everyone with a chronic illness knows how difficult it is to get a needle inside your vein, especially with POTS with low blood volume, and I had such low blood pressure, you could barely see my veins. Whenever I got blood drawn, it usually took them a few tries with a couple of vein collapsing, and I would get bruises all over the place, because they would try in different places. One way to avoid this is to get a port in your chest, and this is probably very helpful if you're getting IVs every day, but if you're only getting them every few days, I would not recommend it, because everyone I know who has gotten one, they say it gets infected very easily. They've all had issues with it. So I would still recommend IV therapy with the traditional, vein in the arm. So how did my clinic successfully set all my IVs when I was getting my treatment? The first secret is to warm your veins up. When your veins are warm, they will expand, so it will be easier to get the needle in. At my clinic, they wrapped a heating pad around my arm to get to warm up before they did the IV. If you're sitting in an extremely freezing cold doctor's office, which you probably all know what I'm talking about. Doctors' offices are very cold for some reason, but that's constricting your veins because it's so cold in there. So make sure to, warm it up with a heating pad, or, if you're in Arizona like I am, you can just stand outside for 2 seconds in the 120-degree weather. The second secret is a blood pressure cuff, and normally they would use an elastic to tie your arm right here to increase that pressure there, but that one, it hurts so bad, and they kind of use it as a turkinet, and I didn't like it at all. I feel like it didn't really help. So my clinic would use a blood pressure cuff instead to increase that pressure, and it was a lot less painful and a lot easier to control. The cuff helped my veins to increase in pressure, and it caused my veins to pop out even more. It would even cause my arm to become kind of numb and tingly, so when the needle went in, it was kind of hard to feel the pain because it was feeling a little numb. So now you're there, your vein is warm, you got a blood pressure cuff on, you're about to get your vein poked, and they're probably going to tell you to make a fist with your hand, and this also increases the pressure in your arm, but that was always very hard for me to do because, well, first of all, my arm was kind of numb, and also I was very weak and I didn't have a lot of energy, so that was hard for me to do. So the third secret is to flick the vein, and that will cause it to pop out more. My vein would go from barely noticeable to very evident, just flicking it. Then they would stick the needle in, and it would never collapse and it would never bruise, and it was not very painful. So I hope these tips can help you, but the best way to have a successfully set IV is to have someone who is an expert at setting IVs do it for you. I cannot stand it when the person poking my vein is blaming my own body because of the difficulties they're having. And yes, I have small veins, but other health practitioners have been able to successfully poke me. You can't blame my anatomy for your lack of vein poking skills. I'm sure in health school the students practice setting IVs on healthy people with healthy veins. I'm not sure if they get a lot of practice on chronically ill patients, so that might be where the lack of skill comes from. So if the person who is trying to poke your vein keeps messing up, get a new person because you are paying them to successfully poke your vein, and if they can't do it, they need to get someone who can. Don't let anyone ever blame your body or say, oh, your veins are too small, or your veins, I can't see them. Don't ever let someone blame your own body on why they can't do it right. Successfully setting an IV is not an impossible task, so make sure to get someone who is knowledgeable and skillful in the art of vein poking. So thank you for watching, and please be sure to hit the subscribe button so I can continue making these videos.